Hello, everyone. Thank you for joining us. This is the last of the 3 sessions and it's going to be conducted by Dr. Kini, who is a pediatrician with over 28 years of experience, and he has been my pediatrician for over 16 years. Today, he will be talking to us about burns, choking, diarrhea, and CPR.
Thank you, Anika, for the kind introduction. Hello, everyone. I'm Dr. Kini. I'm a pediatrician in Bengaluru. So, coming to the first topic of mine, diarrhea. Diarrhea is defined as the increase in the frequency and fluidity of stools in comparison to a person's usual bowel habits. Why is prevention of diarrhea important? Let me put out some statistics. This is from the WHO data. It's one of the leading cause of death in children under the age of 5 years. Each year, about 500,000 children die of diarrhea. Globally, there are about 1.7 billion cases of diarrhea, childhood diarrhea. And if you add the adults to that, it comes to close to 2.5 billion cases of diarrhea. So a lot of people sitting a lot of time on the potty. Diarrhea is the leading cause of malnutrition in children above the age of 5 years. And travelers' diarrhea is one of the predictable travel-related illnesses affecting about 30 to 70% of travelers. What causes diarrhea? Before I go to that, let me go to my first slide. Let me give a brief introduction into the digestive system of the human beings. All the food that we eat gets into the food pipe, called the esophagus, and then gets in the stomach where it mixes with the stomach juices, the gastric acid, and then enters the intestines. We have about 23 feet of the small intestine and about 5 feet of the large intestine. The small intestine that constitutes the duodenum, jejunum, and the ileum. Basically, this is where all the digestion of the food occurs. So all the food is mixed with the digestive juices that come from the liver and from the pancreas. And a lot of fluid is there in the small intestine, which helps in the digestion of almost all the fluid, all the food that we eat. So finally, the digested food enters the colon. Here we have the ascending transverse and the descending colon. The main job of the colon is to absorb fluid from these digestive juices back into the bloodstream. And what is left in the colon is basically the undigested matter, that is the fiber on which the bacteria have their meal. They create a lot of important substances for us, including vitamins. And finally, the waste comes down to the rectum as feces. And when it's culturally appropriate, it is released by the relaxation of the anal sphincter. So now let's see what causes diarrhea. Diarrhea can be caused by an increased secretion of fluid into the intestine. Due to a variety of stimuli, the intestine secretes more fluid into itself than usual. It's usually caused by toxins. Commonly, example I can give is cholera or even food poisoning. It literally is like a tap opening into the intestine. Probably the reason behind that phrase, tap is open. The second reason we can get diarrhea is because of osmotic diarrhea. This happens when large molecules reach the colon without being digested. It usually happens in lactose intolerance. So these large molecules withhold the fluid and prevents its absorption. So the stool remains fluid and is watery, and that's one of the causes of diarrhea. Rapid passage of stools through the intestine. This is usually called motility-related diarrhea. It's usually seen in irritable bowel syndrome. And inflammatory diarrhea caused by infections is usually a combination of 2 or sometimes all 3 of these causes. Diarrhea can be classified based on its duration into acute, persistent, and chronic. I'm going to be dealing with only acute diarrhea for the reason of this discussion. It's diarrhea which usually lasts 1 or 2 days, or sometimes up to a week or 2. What are the common causes of diarrhea? Most commonly, infection can be bacterial, viral, or parasitic. Drugs, commonly antibiotics like amoxicillin, non-steroidal anti-inflammatory drugs like ibuprofen, antihypertensives like olmesartan, Food poisoning is a common cause caused by what are called ETEC, enterotoxigenic E. coli or Clostridium. It can be caused by the toxin which is already present in the food, or the toxin gets produced inside our body after ingestion. Usually causes a very watery diarrhea. Allergies and intolerances to certain foods, commonly, again, like I mentioned, lactose intolerance. Gluten intolerance in celiac disease is also a cause of diarrhea. And of course, stress. I very commonly see it in adolescents before their exams, and of course, even adults before maybe an important meeting, a board meeting, or appraisal in the company. So, what do you do when you have diarrhea? Diarrhea, according to me, is something which is one of the most over-treated conditions. Most cases of diarrhea clear up without any treatment. We must understand that diarrhea is a protective mechanism of the body. Just like when you have an irritation in the throat, you cough. When you have an irritation in the nose, you sneeze. Similarly, diarrhea is a way of the body's way of pushing out the irritant. So there's nothing much you need to do just than to go and sit on the pot more often. Unfortunately, it's overtreated. Sometimes we doctors are guilty too. The most important thing is to avoid self-medication. I'd like to narrate an incident. I was at the medical shop below my clinic, and a person walks up there and says, "Sir, loose motion agide, ulle antibiotic kodi." I think I should tell this in Kannada because there may be people who don't know Kannada. I should tell this in English. So he walks up and says, "Sir, I have loose motion. Give me a good antibiotic." This chemist doesn't know where to look because I'm standing right there. He says, no, I don't give these things without a prescription. Go get a prescription. And that fellow immediately says, no. What you gave last time worked beautifully. Give me the same antibiotic. So that is the level of, over-prescription and the ease at which people can get antibiotics and medications in India. This is something all of us should avoid. All you have to do is drink plenty of liquids. You can drink things like tender coconut water. You can drink electral. You can drink some soups with a little bit of salt, buttermilk with a little bit of salt. One thing I should warn people here is that there is a popular drink called ORSL. ORS is the short form for oral rehydration solution. I'm not sure why this is been allowed to call ORSL because there is nothing close to ORS. There is only one particular product in that lineage called ORSL Rehydrate, which is the WHO formula. The rest of them are all sugary drinks, which will worsen your diarrhea. So be careful what you go and buy from the medical shop in the name of ORS. Solid food as tolerated. In the Indian context, you can use idli, rice ganji, rava ganji, curd rice, etc. The Western world has what is called the brat diet: bananas, rice, applesauce, and toast. This is quite good for pediatric diarrhea. Sometimes adults try their own version of brat diet, especially when they are told to drink plenty of liquids. They go in on a binge of brandy, rum, ales, and tequila. I can assure you it is very likely to land you up in hospital rather than get you better. So alcohol is an absolute no-no when you have diarrhea. Infants should continue to breastfeed. Of course, we say in older children to reduce the milk intake a little because there usually is some amount of temporary lactose intolerance. So milk can be withheld. And strict hand hygiene and social distancing applies to this too, because these diarrheal infections, especially the viral diarrheas, the stomach flu as it is called, is extremely contagious. So sending a child with diarrhea to a daycare center is not at all the right thing to do. When do you see your doctor? You see a doctor when your diarrhea is particularly frequent or severe, when you have 6 to 8 loose stools, especially large volume loose stools. In condition like rotavirus diarrhea in a small child, 5 loose stools can make a child severely dehydrated. As even in adults, when you pass large volume stools, you can get dehydrated very easily. Blood in the stools with a foul smell, this usually is an indication of an infection, especially if there's stomach pain. So you need to go see your doctor. Persistent vomiting if there is persistent vomiting, no amount of oral medication is going to help because it's going to come out immediately. So you need to probably go and get an injection, and if required, IV fluids. Severe and continuous stomach pain. Diarrhea can be a manifestation of a surgical condition in the stomach, especially things like appendicitis or diverticulitis. So if you have stomach pain and diarrhea, go see a doctor. And of course, when you have signs of dehydration, things like extreme thirst, significant weight loss, um, very dry and parched tongue, the reduction of tears, you feeling very tired, very weak, etc. These are signs of dehydration when you get to go and see your doctor immediately. How can you prevent diarrhea? Watch what you eat and drink. I know it's very tempting when you see that pani puri gadi to go and have one plate of pani puri, but remember you get diarrhea and worm infestations free along with that. Get vaccinated, especially in the extremes of age and before travel. Rotavirus, diarrhea, and cholera are two eminently preventable diseases, preventable by vaccination. Stop storing food and eat mostly fresh food, especially the older generation. They don't like to throw food, so they keep it in their fridge for sometimes days together, and sometimes even forget about it, and after some time they don't like to waste it, so they think they'll finish it. But I think we should refrain from this. If the food is more than 2 or 3 days old, discard it, don't eat it, because you can get food poisoning. Good hygiene habits, this goes without saying, particularly hand washing before each meal. One thing I would like to stress is, in children, see that you cut their nails, because a lot of germs can be below the fingernails, which can sometimes be missed, and this can lead to repeated infections in children. And adequate breastfeeding. This is something I cannot stress more. This seems to be a misconception, especially after the child has crossed the age of 1, that breastfeeding is not required, that the child will not eat if the child is breastfed, etc. That is absolutely wrong. It is the current recommendation of the World Health Organization to breastfeed all children till the minimum of 2 years or longer if the mother is still comfortable. This prevents many infections in the child, especially gastroenteritis, that is diarrhea. It also gives protection to the mother against many illnesses, including breast cancer. So it should be a strong reason why women should breastfeed till the age of 2.